Hi and Assalamualaikum everyone, my name is Nur Afka binti Ahmad Ali. So for our case study, me and my friends decided to go for a review mode on Seizure. Let's start by understanding the definition of seizure itself. So seizure is a brief burst of uncontrolled electrical impulses between brain cells, also known as neurons or nerve cells, that results in momentary alterations in muscle tone or mobility such as stiffness, twitching, lameness, sensation or states of consciousness and behavior patterns. Seizures can be classified into two major classes or groups of seizure, which are focal and generalized seizure. So let's start with focal seizure. The term focal seizure refers to a certain kind of seizure that only affects one side of your brain and body. These seizures are often less severe. Focal seizures can start in one part of the brain and spread into other areas, causing symptoms that are mild or severe depending on how much of the brain becomes involved. So focal seizure is known as the most common seizure as it accounts for more than half of all seizures. The symptoms that occur during a focal seizure are determined by the location of seizure in the brain. On the other hand, generalized seizures are defined as seizures that begin when an electrical impulse that affects every part of the brain. It affects both sides of the brain. And this unusual seizure type can occur in both genetic and structural or metabolic epilepsy.
Assalamualaikum and hi, my name is Nur Afifah Husna. So today I'll be discussing about what causes fever and how to prevent it. So high fever, encephalitis and brain traumatic injury, also known as TBI, are one of the causes of seizure. Seizures that are affected by high fever are known as febrile seizure, and it is commonly occur among children aged between newborn to 2 years old. So encephalitis is actually the inflammation of parenchyma on the brain, and there are two categories for encephalitis, which is autoimmune and infectious encephalitis. So TBI are one of the crucial causes for seizure. It can cause seizure at any ages, and TBI are caused by either falling, accident, assault, or anything that cause injury at the head. So early post-traumatic seizure occur within the first week, meanwhile late post-traumatic seizure occurs within 7 days after TBI.
Assalamualaikum and hi madam, my name is Nur Shafika Atira binti Nur Azlan and I will present about the factors that increase the risk of seizure and also the conclusion for our topic. The first factor that can cause the increase of getting a seizure is chemical. Seizures can be affected by several common available risk factors such as cigarette smoking, caffeine intake and also alcohol usage. Nicotine can cause seizures in both humans and animals if taken in excessive doses. Autosomal dominant nocturnal frontal lobe epilepsy, or known as ADN-FLE, is related to nicotinic acetylcholine receptor alteration. Nicotine and its receptor play a crucial role in cerebral neural activity. Seizure infection rates can be more increased easily nowadays with the existence of the e-cigarettes. This is because the concentration of nicotine in e-cigarette are the same as the concentration of nicotine in a pack of a cigarette. The second factor that can increase the risk of getting a seizure is age. Elderly has a high risk of getting a seizure because most prevalent neurological conditions are occur among the elderly. The elderly deals with comorbid condition which is more frequently compared to the younger people and adults. Seizures are linked to several disorders that are age and age-related, and serious health issue in the elderly can also increase the risk of factor of getting a seizure.
Now let's take a look at the most popular treatment for seizure. Start off with benzodiazepines. It has dual effect on the brain's gamma aminobutyric acid, which is GABA receptors. It primarily works by influencing the GABA neurotransmitters, as seizures are associated with dysfunctional GABA neurotransmitters in the brain. This is because GABA inhibits nerve activity that would cause the seizure. Benzodiazepines act as anticonvulsants, increasing the activity of GABA by binding to it and opening the chloride channel in the GABA neurotransmitter, thereby increasing their anticonvulsant activity. Next is vagal nerve stimulator. It is a device that's surgically implanted beneath the skin of the chest, and a wire is threaded beneath the skin to connect the device to the left vagus nerve. Once activated, the device transmits electrical impulses down the left vagal nerves to the brainstem, which then sends signals to specific areas of the brain. The magnet is reported to be effective in stopping acute seizures. As you can see here, the generator is planted on the chest, which will then send electrical impulses through the vagus nerve to the brain through a wire connected to the generator. Lastly, resective surgery, which involves in extracting a comparatively tiny part of the brain. Now you might be wondering, how does the doctors determine which part of the brain will be removed for the surgery? Well, the doctor will determine on the parts of the brain needed to be removed by pre-surgical evaluation, including simultaneously acquired video EEG transcriptions and both structural and functional imaging of the brain.
Now let's see prevention and control. Firstly, when someone has seizure, there is no way to entirely stop it. However, we could take preventive measure. Firstly, keep records of every seizure attack where family members or caregiver record the date, time of the day, duration of seizure, and description of each seizure. They can put it in a journal, and if the patient go to meet doctor, they can give the journal. Secondly, since TBI is one of the causes, people should wear protective gear and take medication that are prescribed from the doctor. Overdose or lack of medication also can cause seizure, and by wearing protective gear such as helmet, it can minimize the fall impact. Lastly, nicotine therapy replacement are also known as NRT. It is very helpful and useful as it can temporarily replace nicotine found in e-cigarette or cigarette to decrease the desire to smoke.
In conclusion, we all know that seizures are a common condition that is caused by nervous system failure. Several types of seizure may differ in symptoms and intensity. There are two types of major seizure, which is known as a focal and generalized onset. Seizure can usually last up to 2 minutes and can be caused by high temperature, brain injury, and also illnesses. Seizure can be treated with medicine such as benzodiazepines, vagus nerve stimulator, and also by a restrictive surgery. The risk of getting a seizure can be increased with a chemical such as nicotine and also an age factor. Family or caregiver must pay full attention if seizure happen to people around them to prevent the seizure from getting more worse. Besides, head protection is the most important thing that we need to do to prevent the occurrence of seizure in a person. And so I guess that's all from our group. We hope that Madam enjoyed watching our presentation video, and thank you Madam for lending your time.